Welcome to Life After 40 Conversations with Philip Blackett. This is a space for honest, thoughtful conversations about midlife, without the hype, without diagnosis, and without pressure. If you're somewhere between 35 and 55 years old and quietly navigating questions about your energy, your identity, your work, your faith, your relationships, or your health, you're not alone. Midlife can often look stable on the outside and feel unsettled underneath. Life After 40 Conversations exist to do one thing well: to give adults in midlife the language, the clarity, and calm perspective for a season that can often feel confusing, lonely, or silently overwhelming. This show exists to help you feel seen, help you feel steady and less alone as you navigate the second half of life. Now, bear in mind, this is not a self help program. It's not a medical show, and it's not even a motivational pep rally. What this is a meaning making space. Each episode is a grounded conversation with myself, alongside leaders, caregivers, entrepreneurs, pastors, parents, professionals, and thoughtful human beings who are living through midlife in real time, just like you and me. We reflect on lived experiences without issuing prescriptions with peer pressure. Because I believe in this deeply. Midlife is worth living and worth living well. And living it well doesn't start with pressure, it starts with perspective. So if you ever thought to yourself, why does this season feel different for me? Or why am I rethinking things that used to feel settled before? You're exactly where you're supposed to be. And I'm grateful that you're here. So with that, let's begin today's conversation. Our guest today is Dr. Kevin Smith. Dr. Kevin Smith is a board certified chiropractor and functional medicine practitioner with vast clinical experience. He has been in practice since 2001. In addition to clinical practice, he's a public speaker and published author. His second book on functional medicine is to be released later this year. Dr. Smith diagnoses and treats complex or misdiagnosed chronic problems without drugs or surgery. Most people come to him because they're frustrated with the lack of results they get from traditional medical treatment. Kevin provides a more unique approach to healthcare where we live in a more drug culture, where the drug companies advertise perpetual drug ads that address symptoms. He believes that instead of chasing symptoms with medications, the functional medicine approach is to find the root cause of the problems. And by identifying the triggers that cause the problem, we can then thoughtfully eliminate them. Dr. Smith, thanks so much for being on Life After 40 Conversations. Welcome.
Thank you very much for having me. It's a pleasure to be here today.
Kevin, thanks so much for being a part of this show here. And so, just to get started with our first question, before the titles, the resumes, or even the introduction, who is Kevin in this season of life?
I heard your introduction, and I think I'm a little bit past that age of 55 where I'm entitled to get a coupon for a free cup of coffee somewhere. So, so I'm a board certified chiropractor. I've been in practice for about 25 years, and when I graduated from chiropractic school, I moved back to Pittsburgh, Pennsylvania, where I was born and raised, and I opened up a clinic. And people would come to me for things that you normally associate going to a chiropractor for, such as back pain or neck pain or headaches, automobile accident injuries, sports injuries, things like that. And I was doing good work and word was getting around, but every once in a while, people would come to see me and they would have some weird, mysterious problem that I could not fix using the tools that I accumulated in chiropractic school. People would come to me with things like low thyroid disease or brain problems or gut problems, problems um, involving diarrhea or constipation, or they had problems with diabetes, autoimmunity. And I could not figure out what was the cause of these problems? What could I do to help these people? And that led me to want to learn more about these problems. And I ended up going to a whole lot of seminars and learning about clinical nutrition. And after a couple of years, I became a board certified clinical nutritionist. And that led me to learn even more. Started to attend seminars on laboratory analysis and interpretation, and things like studying blood chemistry and urinalysis. And that led me down the pathway of functional medicine. And right now, 50% of what I do is chiropractic related. It's about musculoskeletal problems. And 50% of what I do is has to do with metabolic issues. Things like high blood pressure or low thyroid disease or autoimmunity, has stuff that has nothing whatsoever to do with chiropractic care. And right now, where I'm at is trying to help reach into both worlds. So it depends on what the problem is, what the person brings to the table. If it's a metabolic thing, I will reach into the functional medicine arena. And if it's in the chiropractic thing, then I'll reach into that.
That makes sense. And so it's really interesting because I think for some people that are listening to this episode or watching, they may be coming across functional medicine for the first time and ask themselves, what is that? And in particular, why would that be relevant for me in this age group of mine? So I'm just
Okay.
kind of curious for those who are just listening and just hearing functional medicine for the first time. Um, what is that for people?
So there's two broad categories of healthcare that you can get as a consumer. Number one is called allopathic healthcare. And allopathic healthcare is what most medical doctors will do. The purpose of allopathic healthcare is to chase after a symptom, usually in the form of a chemical like a drug. And that's typically what medical doctors do. Whereas functional medicine is a personalized, patient centered approach to healthcare where we ask the question, why? Why do you have high blood pressure? Why do you have autoimmunity? Why do you have low thyroid disease? What's going on behind the scenes? So it's a root cause question. Ultimately, uh, we want to figure out what are the driving factors that are causing this problem to occur in the first place. Nobody has a healthcare problem just because they don't mysteriously appear out of thin air. There's always something that's causing this in the first place, whether it's um, whether it's anemia or it's chronic inflammation or it's an allergy to a food that you may be eating all the time that is causing a lot of harm in your body. And so it requires me to put on a bit of a detective hat and do some foundational lab testing to figure out what is driving your problem in the first place. And it just so happens that I work with people in the same age bracket that you do. So people typically don't have chronic issues when they're a teenager. They typically don't have chronic problems even as a 20-year-old. It tends to happen a little bit later in life. Not necessarily all geriatrics, but people in the mid part of their journey is when these problems start creeping up. And so what I tell people is if you have a problem, the first person that you need to talk to is your primary care physician, your family
Mhm.
doctor. And after people have already tried that, after they've already tried the drugs, after they've tried the medical treatments and they're still not happy with where they're at with this problem, then it's time to try something different. There's no use going over and over and over to the same source each time. It's time to try something different. And that would be somebody like me.
Yeah, that makes sense. I don't know if you noticed, Kevin, but part of my interest in this subject is because I'm actually back in school, in my older age, so to speak, relatively speaking,
Mm,
to essentially become a functional medicine certified health coach.
okay.
And part of when I first heard of you, what really interested me was like, okay, here's somebody that is more well versed in functional medicine that I want to get to at one point later on in life. And so I think what's interesting to me, and I'd love to get your take on this for the audience here. I come from a family of doctors. I don't feel like I was smart enough to go into medical school, but at least for me, getting into functional medicine is like my attempt to be able to be of service to people, do no harm,
Uh-huh.
um, in my own lane, right? Oftentimes, people who maybe have just heard of functional medicine just now, or may have heard of it before, try to figure out what's the relationship between, as you said before, um, what physicians like your family doctor would practice. How is that in relation to someone practicing functional medicine? Are they in conflict with one another? Do they complement one another? How would they potentially work together or in the whole sequence of working with someone in midlife in particular?
Well, I'm not anti drug, I'm not anti physician. I believe that there's a time and a place for all healing. There's a time and a place for medicine. There's a time and a place for doctors, for chiropractors, physical therapists, acupuncturists, massage therapists, etc. But I believe that as a people, we are over medicated. And I think that what we need to bring to the table is an is a different approach, a different set of skills than what people typically get when they go to the medical doctor. So, if you ever see a picture of the tree of life, there's different branches in the tree. One of those branches could be the cardiovascular doctor. One of those branches could be a neurologist. One of those branches could be a kidney doctor or a nephrologist. One of those branches could be a dermatologist or a skin doctor. There's all these different branches of the tree representing different branches of healthcare, of allopathic healthcare. I am the root doctor. So I look at the root cause of the problem, not just chasing after symptoms.
Hmm.
So what I've found is when you go to a primary care physician, by the time you even walk in the door of the doctor's office, your treatment plan has been predetermined for you before before you even have a chance to walk in the office. And that treatment plan has been determined by the insurance company. And more importantly, it's been determined by a actuary that works for the insurance company who has never met you, has never looked at your labs, has never looked at your x-rays or done an exam, but he is making clinical decisions for you.
Hmm.
So the medical doctor is going to basically look at your insurance, and then he's going to do exactly whatever the insurance companies say that they will pay for and nothing more. And so instead of using the insurance company to make clinical decisions for you, I think that the doctor should make clinical decisions for you. This is a source of frustration for medical doctors as much as me and the patients because their hands are tied behind their back by the insurance industry. And, it's funny. It's like one of the things that people say when my phone rings is, one of the first things out of their mouth is, "Do you take my insurance?"
Mhm.
That's the wrong question. The right question is, "Can you help me?"
Mhm.
Because if I can't help them, there's no reason even having that conversation. So what I do is I say, "Well, I don't know yet. We let's do a benefits and analysis for you to find out what you're entitled to get. And if it covers this, great. If it doesn't cover it, well, at least we know. But let's find out really what's going on here." The more important thing is that people need to understand that you are responsible for your health. I'm responsible for my health. But people think that some way, somehow, somebody else or something else is ultimately responsible for their health, whether it's the government, an insurance company, or whatever. They need to divorce themselves from that line of thinking and start thinking about who is the best doctor for me. If, God forbid, somebody needed an oncologist, they had cancer, would they go to the cheapest guy in town? Or would they go to the most competent doctor that knows the most and can save their life? Or if you needed a cardiologist, would you go to the cheapest guy in town? Or would you go to somebody who's board certified, knows what they're talking about, can create a meaningful impact in their life? So I think that really, ultimately, you want to align yourself with a doctor that can help you and can help solve your problem, much more so than say who is going to take your insurance.
Mhm. That makes sense. One of the things I picked up on what you said, Kevin, was, you know, so I have a primary care physician and I go for my annual checkup, just like if you go to a dentist
Yep.
twice a year for cleanings and that sort of thing. So for the physician, the family care physician, once a year for the annual checkup. And I think one of the things that kind of dawned on me that I didn't realize, even thinking about it, and it's related to what you just said, is that, okay, so I go to this doctor once a year. And I probably meet with him when I finally get through like the paperwork, updating, my file, making sure insurance is covering this and that sort of thing. Doing the measurements, the blood pressure, the weight, all this other stuff.
Uh-huh.
When I'm actually like sitting in front of the physician, it's probably 15, maybe 20 minutes. And that's it. And it's just like, oh, you're all good to go. All
So
right,
that's
I'll see
actually
you.
that's actually a lot. The national statistic is 7 minutes.
Wow.
7 minutes of face-to-face time. The rest of the time, when you walk in the door, it's the medical assistant,
Hmm.
not the doctor, that's gonna be asking you most of the questions. So, like, "Has there been anything new in your life? Are
Right.
you still taking the medicines? Um, have you had any new complaints? Anything that we need to know about?" And the medical assistant's the one that's gonna weigh you and, take your pulse ox and all that stuff. And then the doctor's going to walk in with their laptop computer and he's not even going to be looking at you. He's going to be facing away from you, typing into the computer. And then he's going to take your blood pressure, palpate a little bit. The exams that they do is so superficial. People are so used to getting a superficial level exam. It's like a glossy veneer of healthcare. Whereas when you go to see a functional medicine doctor, you could spend an hour. You could spend 2 hours with the doctor because the functional medicine is going to ask you, why do you have this problem? They're going to order a whole lot more labs. So the labs that the primary care physician orders, they're going to order a very, very narrow bandwidth of tests in order to arrive at a diagnosis, in order to prescribe a drug. In other words, they're going to do exactly whatever the insurance companies dictate that they will pay for and nothing more. Whereas functional medicine is more concerned with looking at the entire metabolic pathway and figuring out where the breakdowns could be located. And then prescribing a care plan based on what you need to optimize your health, not based on satisfying some insurance company's regulations. So I didn't mean to really dive too far into insurance, but you need to understand this is where this is coming from is the insurance companies dictate, and medical doctors are very, very frustrated. They feel like they walk into work with one hand tied behind their backs all the time.
Hmm.
And it's not just in private practice. This kind of nonsense goes on in hospitals as well. And it drives a lot of policy and what they do, like for example, in the emergency department, everybody that walks in that door is going to get a CT scan, not because it's necessarily the best medicine practice, but they want to pad their bill for for the hospital. So if you get involved in a car accident, you're going to the CT scan. No ifs or if buts, ifs or ands about it. You're going to go, and that's going to add another $3,000 to your bill that your insurance company is going to have to cover. And so there's a lot of money and politics and tradition involved in the clinical decision making of what's in it for you.
Hmm. That's interesting because I think where I was going with that too, Kevin, was the thought of clearly it sounds like my doctor spends more time than with me than average, which I think I should be more thankful for in that case.
Absolutely.
Um,
You got to tell me who you go to. I want to go to them as well.
so I think even in that case too, Kevin, it's like, okay, so if I meet with this doctor once a year, the average is 7 minutes.
Mhm.
If you're lucky, 15. But that's all you're meeting your primary care physician with over the course of 365 days.
Right.
It's all down to 7 minutes, maybe 10, maybe 15. And what really kind of dawned on me at that point when I thought about it was like, okay, why am I having all this boil down to just 7 minutes a year? Because I'm living much more than 7 minutes a year. And I'm
Right.
having to make decisions about my health and wellness more than 7 minutes a year as far as, what I eat, how I move, how I think, how I recover, how much I sleep, all these different things on a daily basis, just like everyone else here that's watching and listening to the show. And then it's like, why am I only putting all this emphasis on this one visit versus thinking, what do I do outside of it? How do I come about what's my plan
Yeah.
afterwards or beyond before and after that?
Well, medical doctors, I'm friends with a lot of medical doctors. They recognize and that there are certain things that we need to do to protect our health. But getting people to comply with those is a whole different issue entirely.
Right.
We understand that um, a good diet, a good nutritious diet is very, very important. They understand the importance of drinking water. They understand the importance of getting sleep, of managing your stress, of exercising, of paying attention to your joints and your posture. They understand all that stuff. But that's not the world that we live in. With the world that we live in, as far as primary care physicians, it's all about volume. Either you can have high prices or you can have high volume to make
Mhm.
money, but you can't have both. So, specialists like a cardiologist typically is going to spend more time with you. They're going to see fewer patients, but they're going to collect more money per visit or
Mhm.
per procedure. Whereas a primary care physician is going to be all about high volume and low time per visit. So a primary care physician is kind of like if if you excuse the football analogy.
Sure, go for it.
I'm from Pittsburgh, so it's all about football here.
No
Uh,
problem.
the primary care physician is kind of like the quarterback.
Okay.
So what their job is to figure out can they help you, or do they need to refer you to another guy down the street that may be better suited to helping your problem? Whereas a functional medicine practitioner is going to do everything in house. The functional medicine doctor is going to do some identify, first of all, we want to identify what could be causing this problem. And the way that we do that is by testing. And the tests that we do come in the form of blood, urine, stool, and saliva. And so we send you out to a lab, or we have you give you a test kit and have you collect a specimen at home, and then we mail it out to the lab. And then they're going to take an objective measurement, and they're going to look at, this is where you are, this is where this is normal. Can you see that you're not normal? And then we can build a case for prescribing some lifestyle modifications or some supplements or whatever that you actually need. So the purpose is not just to chase after symptoms. The purpose is to prevent symptoms from happening in the first place.
Right. Right. Because it often comes off to me where it's just like the medical care we're used to, it's more so like it's either routine, like I'm gonna visit my primary care physician once a year. Um, and on the other end, it's like acute, where it's like, uh-oh, there's a major problem here. I'm feeling a huge symptom here or a number of symptoms here. Let me figure out what that is and what's like the immediate pain relief or intervention right there, which is often on the back end of it, as opposed to what you're saying is more of a proactive before we
Oh, are you
get
still
to
there?
that point. Let's prevent that symptom from even bubbling up and showing its face at this standpoint. And how do we get ahead of that?
I think your internet froze on me.
Hey everyone, welcome back to Life After 40 Conversations with Philip Blackett. My guest here today is Dr. Kevin Smith, and we were just involved in a really engaging conversation about functional medicine and how it applies to people, especially after the age of 40, right before we had a little bit of a snafu caused by technical difficulties. But no worries. We're back right here and we're getting right back into the conversation. So, Kevin, thanks so much for joining us here.
It's going to be back again.
So I think when we last left off, we were talking about, really helping people over the age of 40 understand what functional medicine is and why is it particularly helpful to learn how that could be helpful and applicable to them alongside what they're used to, which is more so your regular checkups with your primary care physician. If you happen to have more of an acute care problem, you might see a specialist. But just kind of really understanding, where does functional medicine play a role with people now?
So I think that I need to point out, bring back something that you mentioned earlier, is that when you go to see the dentist, um, most people go to the dentist once or twice a year for checkups, and that is the reason. The reason for that is because at some point, the American Dental Association, in conjunction with the people that make toothpaste, invested $1 billion into a nationwide education campaign. It started in 1960. So
Wow.
1960 billion dollars is a lot of money.
Yes.
I can't even imagine how much that would be today. But when I was a kid, somebody would come to the school and give us these little red tablets to chew up and then look at our teeth in the mirror and look at the where we had plaque, where we might have missed brushing. And that was to educate people about the importance of brushing and flossing and getting periodic checkups. Um, that the Dental Association was so far ahead of its time compared to other branches of healthcare because they taught people to be proactive with their health and do things to prevent cavities and tooth decay. Um, allopathic medicine, is a little bit behind the times. They try to do a wellness exam, but it's mostly just like you go in, you tell them what's going on, you chew the fat for a little bit, He gives you about 7 minutes of face to face time, and then you're out the door. And they don't really dig in and really figure out what's going on with you. When you go to see a functional medicine practitioner, you can expect to be there for about an hour to 2 hours, as the doctor is going to go in a lot of detail and a lot of depth about your different conditions and what they mean and what could be contributing to the problem in the first place. So, in many respects, functional medicine is very much like how dentistry has evolved, more so than allopathic medicine. Allopathic medicine is only about chasing symptoms. So we're conditioned to think that if you don't have any symptoms, you're perfectly fine. You don't need a doctor. And we know that that's not true. So, for example, you can't feel atherosclerosis forming in your arteries. You can't feel cancer cells forming in your body. You can't feel diabetes starting. You can't feel high blood pressure. That's why they call it the silent killer. You can't feel any disease at all until it's reached a certain threshold. And so much damage has already been done that it starts to create a symptom. So that begs the question, when is the right time to see a doctor? Before you develop a symptom or after you develop a symptom? And that goes to the heart of the question that I asked before. Are you more proactive with your health, or are you more reactive with your health? We have been taught to be more reactive with our health, to wait until a symptom erupts, and then you go get a drug, and that's usually what it takes to suppress that symptom. My thought is that you should really be more proactive, figure out what's going on, and nip it in the bud before it even has a chance to rear its ugly head.
No, that makes perfect sense, Kevin. I think to your point, I agree with you. We should be more proactive with our health rather than reactive, because at that point, when you're reactive, you're really, like you said, you're trying to take care of symptoms right then and there that have taken time to accumulate, to build
Right.
up to grow into. It's almost kind of like when, people do screenings and they may find a lump, and they say like, oh, well, good news is, Kevin, we caught it when it was benign, or when it's like stage one and not stage four, in that sort of sense as well. Like, you want to nip it in the bud right then and there because you don't want it to develop into a stage three, stage four. And it's like, now it's like, before we even get to that point, what can we do to be more proactive so we don't get to that point in the first place? I think that makes a lot of sense
Yeah, it
there.
does. So I want to embellish on what you just said. When is the best time to treat cancer? Do you want to wait until you have a malignant tumor? Or do you want to do whatever is necessary to prevent this from developing into a lump in the first place? Even a benign tumor is not acceptable in my book, and it shouldn't be in your book either. You want to prevent this from happening in the first place. And there's some cancers that are related to lifestyle choices. They're related to, say, are you eating a lot of heavily processed foods that are loaded with sugar? Are you exercising? Are you managing stress? Are you sleeping 8 hours a day? Are you getting plenty of exercise to challenge your body and your muscles so that they're healthy and you're nice and flexible and you can do whatever you need to do for work and for play? So, um, I really want your listeners to really think about, when is the best time to get this problem handled, before after it manifests into a full-blown problem with symptoms and everything else and pathology, or do you want to be more proactive and handle it before it actually has a chance to manifest into an out of control problem?
No, that makes perfect sense. I agree with you. Because I think in one sense, someone shared with me, like, when people have talked about business, it's like, hey, it's great, Philip, to have a product that you address as a painkiller versus as a vitamin. And I was like, well,
Yeah.
help me understand why that's the case. And it's like, well, as a painkiller, they are feeling the pain now. It is a huge inconvenience. It is a great concern for them. They want this addressed now. They want this out of their system now. They are willing to do whatever it takes to do that now, as opposed to a vitamin. Yeah, we may know it's good for you. We may not be able to see tangibly in real time the benefits after taking it. And yet we also think to ourselves, well, if I happen to miss today, it's not the end of the world. I can just hopefully remember to take it
Yeah,
tomorrow. And I think to your point, Kevin, when I think about those two comparisons, we should be seeking the vitamin because what happens there is we are trying to put the right healthy habits in place so that we give ourselves the best chance, not guaranteed, but at least the best odds that we won't need necessarily a painkiller later on in life.
it's a great analogy. I may have to steal that.
Go
I
for it.
I wanted to I'm also a chiropractor, and I've been in practice for 25 years, and I've heard it all, and I've seen it all. And, this is a little bit of a joke, but people want me to fix 30 years of degeneration with one adjustment. They don't wanna pay for it, and they want a mail order, right? But as Americans, that's kind of what we're used to. We're used to mail order and drive through and super convenient and instant gratification. And guess what? Health does not work like that. You can't get rid of a healthcare problem overnight. It didn't manifest overnight. It took a while to come to fruition. And so people are so used to just dealing with a superficial, glossy overview. Just give me enough, just enough so that the symptoms are not bugging me and wrecking my world, and that's all I want. And
Mhm.
that is not good enough for me and my patients. It shouldn't be good enough for your listeners either. You should be more proactive with your health and recognize that your health is the most important thing in the entire world. It's more important than money. It's more important than career. It's more important than family because if you're dead, you can't enjoy anything, right?
Right.
So health is kind of like oxygen. You don't really pay any attention to it until it's taken away from you.
Mhm. Mhm. Absolutely.
Yeah.
And so I think what's helpful there, for people listening and people watching is understanding, hey, we all got to start from somewhere. Like the first things first, if we can at least come to the acknowledgement that, as Kevin mentioned before, it's just like we don't want it to wait till we get to that point. We don't want it to be 30 years of degeneration to all of a sudden expect an adjustment or go somewhere to look for a quick fix or to get something to take care of what has accumulated over time, right? Because they often would say something along those lines of if you do get this sort of bad news, you may have something to help with the quick and now, but they usually are coupled with as well as like, well, you're going to have to make some adjustments to your lifestyle, how you go about eating, how you go about moving. Um, and so I think one of the big questions I want to, you know, dig a little bit deeper for our listeners and our watchers here is that, hey, Kevin, I'm listening, I'm hearing what you're saying. I get it. It makes sense. I don't want to have to wait until the diagnosis. I don't want to wait till the primary care physician says, looks like we need to be doing some extra blood work here. I want to get in a place where that is far s- out there as possible, or even better, if possible, not even addressing that at all. And so when you come across people, whether in your practice or just in general, people that are middle age, between 35 to 55 years old, for example, and they are open to learning, how can I start to think about what are the right things to consider putting in place for me, for me to give myself that sense of, I love seeing you, Kevin, but I also want to know if I can help myself from having to need this in the first place as far
Right.
as an adjustment. That's great too. And just like I love seeing my physician, but if I can do this as a more routine thing rather than an acute help me now stage, that'd be great. So like, how what would you share for people that are thinking along those lines of like, hey, how can I just get started? How can I look at this from the right approach here?
Well, the first thing I would say is congratulations because uh, they are becoming more enlightened about what it means to be truly healthy. And you want to be able to do what you want, everything that you want to do on your terms. So you don't want to have to be reliant on taking pills endlessly for the rest of your life just to manage to stop a symptom from happening. The first thing that has to happen is a functional medicine practitioner needs to start by investigating your medical background to look at all the different things that you're up against right now. What kind of symptoms are you having? What medications have you been taking? All that kind of stuff. And take a look at what the medical doctors have already done for you and have you fill out like some intake paperwork. After that, then I think it's very helpful to take a look under the hood by taking a look at some questionnaires. They're not a diagnostic, they're a place to start looking. So I use a metabolic questionnaire and a neurotransmitter questionnaire. The metabolic questionnaire involves things like blood glucose and the peripheral utilization of glucose, liver and gallbladder function, gut function, electrolytes and pH, your adrenal glands, your thyroid, your sex hormones, um, and any kind of an issue that you're already noticing could be happening right away. Again, it's not a diagnostic; it's just a place to start looking. And then I also want to do a neurotransmitter questionnaire. It has to do with the brain and your chemicals that regulate things like memory, cognition. Are you using blood glucose effectively in your brain? How's the neurochemicals doing, like serotonin, dopamine, gamma aminobutyric acid, and acetylcholine. There's about 57 different chemicals, but let's just look at the big four first. And then from there, then we want to do some foundational lab testing. The foundational lab testing is going to be a little bit more comprehensive than what you're going to get at the primary care physician. The PCP is going to order just enough tests in order to arrive at a diagnosis, in order to justify to the insurance companies to prescribe a drug. He's going to do exactly whatever the insurance companies dictate that they will pay for and nothing else. So it's very important for him to look at your insurance benefits and see exactly what they'll pay for. And that's what level of coverage of testing you're going to get. When I order tests, I order a lot more tests. They may order about 10 different tests. I'll order between 60 to 100 different tests because I want to look at the entire metabolic landscape and see where the breakdowns could be occurring. And then look for any kind of what I call triggers. Triggers are things that can disrupt normal physiology and cause a problem or a potential problem. Things like anemia, which is a problem transporting oxygen throughout your body on your red blood cells. Blood sugar problems, blood sugar imbalances. That is probably the number one stressor in the entire body. Cortisol, which is your stress hormone that regulates your autonomic nervous system, your fight or flight response. Sex hormones, estrogen, progesterone, testosterone. Remember, boys and girls make both, and they have to be in the right amount for your gender and for your age. So a 58-year-old man is going to have a very different profile from a 22-year-old woman. Chronic inflammation and oxidative stress, uh, GI problems, food sensitivities, chemical sensitivities, stealth infections, autoimmunity. All that stuff has to be taken into consideration as a possible thing that could be driving your metabolic breakdowns. And that is where I would start by looking at your past medical history, by doing a consultation, by ordering lab testing, and then from there have a pretty good understanding about what we need to do to bring the body back into balance so that you have the opportunity to feel great again.
I love it. I love it, Kevin, because this is much more of a next step for people.
Yeah.
Even if nothing else from this episode, for people to think, okay, is there a next step for me beyond the appointment with my primary care physician? If
Yeah.
I want to be more proactive about my health between the time I met with my physician and a year from when I next meet with my physician, what can I do in the meantime? And I think about the lab test, for example, like even just from what you said before, like it might be 10 that a primary care physician may recommend for its particular reasons. You sharing from a functional medicine practitioner perspective is almost 10 times as many tests.
Yeah.
And I want to hit the hidden concern that might be in someone's mind thinking about this or hearing about this. It's, oh gosh, 100 tests. Do I have to take 100 tests right after one another?
No, no.
Or,
You
because I'm not a test taker. I don't want to take 100 tests. Sure.
it's all based on one blood draw. So by looking at a lot more tests and applying a more stringent method for analyzing what's going on, we are able to find out much earlier on if you have a problem that is worthwhile to treat to get back into balance. And the good news is that everything that I do is drug free and non-surgical. So what I typically do is I want to find out what is required for health. And to answer that question, we have to figure out what is required for basic life. And there are some things that are. So for the cornerstone would be excellent nutrition, making sure you don't have any nutritional deficiencies, making sure you're eating real food. You're not uh, buying heavily processed food from fast food joints, and you're eating lean meats, fruits, and vegetables primarily. Number two, you're well hydrated. You're drinking plenty of filtered water and you're flushing your system out all the time. Number three, you got to make sure you're sleeping well. You get a plenty of sleep, about I would say 6 to 9 hours a night of restful, replenishing sleep, so the brain has the chance to recharge and tackle whatever challenges that you throw at the next day. You got to make sure you're exercising. You're getting about at least 3 hours a week of vigorous exercise. If all you can handle is going for a little walk, that's all you can handle. That's fine. The next week, try to push the time or push the intensity a little bit, and just build upon whatever you can. You want to make sure that you are managing the stress. Everybody has problems, everybody has stressors. So making sure that you're incorporating certain tools to deal with that, whether it's meditation, it's journaling, it's doing a mind dump and where you're everything that goes in your mind, you're putting it out on paper so that you're no longer spinning plates in your head and you're paying attention to your frame and your joints. I do that through chiropractic care, but you can do this through other means. If you pay attention to these fundamentals, you're going to require fewer drugs. You're going to require fewer doctor's visits, fewer emergency room visits. You're going to feel better. You're going to sleep better. You're going to have more energy. Your entire world will be changed. So that's the way that I would recommend doing this. And then I will also use some supplements to do just what it says to supplement a healthy diet. So you can't go to McDonald's 6 days a week and then biggie size your Lipitor. You have to make sure that you're doing the fundamentals and then you're taking certain supplements to uh, round the edges. Nobody's diet is perfect 100% of the time,
Right.
right? So that's why we have multivitamins and fish oils and probiotics, and what you need is going to be based on whatever the labs say. So it's not based on guesswork; it's based on objective measurements that we get from the labs, and that's the best way to help people.
What I like about that is just what you just underscored at the end, Kevin, is because everybody is different.
Yeah.
Everyone has more so a personalized way of going about it. And what I like about this approach for people listening in is, your approach is going to be different. Like there's going to be some consistency with what Kevin's mentioned before, as far as when he's talking about, the type of foods to eat, exercise, sleep, and that sort. But there's like kind of a range you kind of work with. And what's helpful is that these tests, like he said, it's like, thankfully, you don't have to take 100 tests right after another. It's just one blood draw. And
Exactly.
because of how technology and where the medical profession is at this point, how they go about testing, they can get so much out of just one draw to be able to determine where you are in different levels with different categories, different tests. And then from there, having someone that can walk you through what those results look like. And more importantly, what does it mean for you? Like, how do you actually apply it that's personalized to you? Because it's just off of your results. So it's going to be more so what is going to help you. And then from there, you at least have a roadmap. You at
Right.
least have a blueprint where you say to yourself, okay, I just met with my primary care physician. I went ahead and got these tests more than the 10 that he or she recommended to me. I got a pretty wide variety of things to test for. I did that. Now I got these results. Now I'm having someone walk me through that. Someone like Kevin, for example. And now what can go off of that is, okay, what can I start small today? Because like you said before, if you're eating McDonald's fast food, for example, 6 days a week, unless you're really motivated, it may be hard for you to go from 6 days a week down to one or zero.
Yeah.
But you can start to say, hey, from what I've learned, can I take it down from six down to five? If I haven't been walking at all outside, can I say, hey, 3 hours sounds like a lot, but can I at least start with maybe just 10 minutes, maybe after work, just to clear your head?
Yeah.
And what I like about this is that it very much is adjustable, and you can find ways that you can do something small. And then that also accumulates, not just the bad stuff, but doing the good things over time can accumulate where you could start with 10 minutes of walking, and then you like it. Then next week you start with 15, or you start with 1 day a week and now it becomes 2 days a week. And, meal planning, 1 day a week may become two. So it's like it can always go the other way around as far as accumulating on the good side. And just that notion, you have a blueprint, you start small, and you just gain momentum over the time. And that seems like what can be hopefully more manageable for people listening and watching, something that they can say, hey, I know I'm just getting started. I don't know a lot here, but I at least have something I can start working towards to get to where I'm ultimately trying to go.
I talk to my patients all the time. And I'm like, look, you didn't get into this mess overnight. It's unrealistic to expect to get out of it overnight either. Um, Maybe it took decades to get to where you are now from bad habits. Good habits lead to good health, bad habits lead to bad health. And so you got to start somewhere and do whatever you can to at least give yourself a foundation and build upon that. Like you said, uh, 1 day of walking leads to two, two leads to three. The weather's starting to get nice outside, so go outside and play like did when you were a kid, and leave the electronics at home, and leave the stress at home, and go out there and go for a walk, walk your dog, go for a bike ride. do whatever you got to do to start moving again and pay attention to getting all the other parts that I mentioned earlier into your daily routine. And I think that people would be surprised by how much better that they're going to feel. I think that a lot of chronic issues started with a breakdown that they're not getting as much exercise as they should. They're not eating as they should. They're not going to the chiropractor. They're not managing their stress correctly. They're not getting enough sleep. And so after a while, it starts to build and build and build. And then you get to a point where you start to have a breakthrough symptom. And as Americans, we're conditioned to reaching for the medicine cabinet. We live in a drug culture, don't we? And so we want to reach for the medicine cabinet. And when that doesn't help you, then you go to the primary care physician for something stronger. And again, that the whole thing is regulated by the insurance industry. And so I don't think that the decisions that you make should be based on what your insurance will pay for. I think it should be based on what you need. And those people that are enlightened enough to understand that most people are going to need more help than the superficial approach that's done by primary care physicians. When you get 10 different tests as opposed to the correct amount, you're not going to get all the information. So, how can the doctor possibly diagnose every problem that's out there if he doesn't have all the information available to him or
And what
her?
I like about that too, Kevin, is even with those tests, that's something you can track as well over time as well.
Correct.
Like
Yeah.
those habits, those healthy habits you put in place, exercise, nutrition, sleep, stress, management, all the above. Now, if you take these tests, you can look at it as like, I'm making an investment in my health. We start with the baseline, year one. Hey, whatever the results are, those are the results. And we're looking at whatever they say, we're looking to improve on them. And then you actually can, I wouldn't necessarily say gamify it, but you would see it as something that you work towards that you might get some energy out of. It's like, hey, this is where we started. We're going to put some things in place. I work with a functional medicine practitioner like Kevin um, to figure out what can I do that works for me. And then over the course of the next 12 months, you take those tests again just from one draw. Hey, here's where I was year one. Here's where I was year two. You ask somebody that can help you with those results. Hey, where did I improve? Do more of what it was doing before to keep improving it. Where are some things I should address in year two?
So, I want to comment on what you just mentioned. That's what I do in my office. We don't just have normal or needs improvement. I color code the lab results, either green, yellow, or red, just like a stoplight.
Hmm.
So if it's green, that means that they're in the sweet spot. That's exactly where they should be. Ideally, everything should be green. Then if it's yellow, they're moving in the wrong direction. Just like a red light that tells you caution, you need to slow down, you need to pay more attention. Medical doctors assume that everything's fine, but if you're moving in the wrong direction, you should start paying attention to what's going on with your health. And then if you're red, you're in full blown pathology. So look at liver markers, kidney markers, thyroid, um, the blood lipids, the anemia patterns, all these different things. We want to color code that as red, yellow, or red, yellow, or green, and find out exactly where you are. And then we want to retest you based on what showed up originally. I don't think we have to retest everything, but
Okay.
we should retest the reds and the yellows and see if we've moved the needle. And we want to do that every 90 days.
Okay.
But takes about 3 months to make a major metabolic shift in the body. You're going to see this stuff show differently on the lab tests far before you see a symptom change. So symptoms are the last thing to show up. That's why it's dangerous to judge your health based on how you feel. You don't want to wait until you have cancer. You don't want to wait until you have heart disease to start doing something about this. A person can't feel their blood pressure rising. They could feel some stress, but blood pressure is known as the silent killer. And so, what you want to do is monitor this on a consistent basis and see what you can do to make some healthy changes in your life.
No, that's even better. Doing it every 90 days as opposed to a year on certain tests.
Right.
Because I
Right.
think there is just, I think that the point we're trying to make is just you can do something in between the doctor visit.
Yeah.
And preferably, we are grown adults now. We should be able to do that. If it is something that health is important, whether for you or your family or for your job, um, like you said before, health is right up there with oxygen. Oftentimes we do take it for granted, especially if we got high work responsibilities, if we're taking care of kids, maybe aging parents. Um, Health oftentimes is on the back burner
Yeah.
until you get the diagnosis, until we take it for granted to the point where now we're really trying to grasp for it.
So, one thing that I often say during my when I'm doing a live presentation and I'm doing a talk, I will ask, "Can I have a show of hands? How many people in here own a car?" And watch the hands go up. Okay. Now, how many people that own a car change their oil every 3 to 5,000 miles? Everybody's hand goes up again. That's a piece of metal that they're going to throw away in about 5 years. And yet they will nickel and dime themselves when it comes to their own health. But they'll do whatever it takes, whatever the instruction manual says about their car. It's kind of backwards. Now, I realize that a car comes with an instruction manual on what to do about this, and we don't. We're not born with instruction manuals. And so we have been sold lies. We've been sold a bad bill of health that there's a pill for every ill, and you should wait until you have a symptom, and you should only get this stuff looked at once a year, if at all. And some people don't go to doctors for years and years and years. They wonder why they're falling apart so much. So be as proactive, if not more, than you are with your car, and pay more attention to your health and get this stuff properly investigated by a functional medicine doctor.
I like that analogy because even whether it's a car for 5 years or maybe it's a home for 30 years, it's like, you know, just by us going into midlife, Kevin, our bodies are at least going to last longer than either one of those, 35 to 55 and beyond.
Well, we hope.
Absolutely. Like, we hope, of course. Um, but it's also to that point too. It's just like, I think grappling with what you share, like things that we care for, we pay attention to.
Yeah,
This is the means to get from home to work and back and vice versa, and the place we stay and that sort of thing too. Well, the same could be said for your human body. That is your way of movement before cars existed.
yeah,
And at the same time, you only get one body. That is where you are housed in until, life is over. So why would we not look into ways to keep ourselves in the best possible shape for as long as possible?
I agree.
So, with that, Kevin, I think this has been really helpful conversation on the topic of, being proactive about your health, what functional medicine is and how it can apply for people in midlife. I always ask my guests, when you think about midlife and beyond, Kevin, and love to learn from your perspective here. Are there any sort of beliefs or healthy habits or rhythms of yours that have become non-negotiable for you now in this chapter of your life now?
Well, I mentioned it before. There's a couple of things that I advocate, And those are things like proper nutrition, proper hydration, sleep, sleep habits, going to the chiropractor, um, making sure that you are managing your stress, making sure you're going to the gym or you're going outside and getting some exercise in. Those types of things don't seem like a lot, but they are very important for the general maintenance and health of your body. And I would encourage everybody, all of your listeners and anybody that will listen to me, to focus more intently on the basic fundamentals. And you're gonna not to you're not gonna need to rely on pharmaceuticals for as much if you just take care of yourself. And that would be my recommendation. Again, it's proper nutrition, hydration, plenty of sleep, exercise, chiropractic care, and managing your stress, whether it's physical stress, chemical stress, or psychological stress. You want to make sure you're managing that very well so you are a well adjusted, healthy individual.
Excellent. Yeah, absolutely. And so, as we start to wrap up our conversation here, Kevin, I want to be thankful or thoughtful, I should say, of if there is someone that's watching or listening to our conversation right now, and he or she is feeling like, they're trying to make sense of where things are in midlife for them. Maybe they're just kind of doing the best they can managing it all, but they know they need to do something with regard to the health, or flat out just might admit that they're just burning out in this new chapter of life for them. What would you want them to hear from you right now?
Well, I think that I want them to be more active, ask questions, get involved, do things more proactively. And one of the things that you can do is to go visit my website at metabolicsolutions.net. And from there, you can read about me and read about what I do and my unique approach to helping people with various problems like thyroid disease or high blood pressure, autoimmunity, diabetes, things like that. And on metabolicsolutions.net, I have a free health quiz. It takes about 2 minutes. It's completely free, and when you complete this, uh, I will send you an action plan of what you can do based on how you scored. So if you have a very minimal amount of problems, then I will recommend certain websites that you can look gather some more information on and continue to learn and read up on stuff. If it's a moderate problem, maybe I will add you to some send you some free emails that shows you more information about uh, nutrition or hydration or exercise or whatever you're lacking in. And if you have a very serious problem and you want some help right now, you want to speak to me, I will make myself available to you. And I have a contact form on the website at metabolicsolutions.net where you can send me an email. And I'm pretty good about responding to emails. I'll get back to you and we can have a phone conversation or a Zoom call. And I can listen to your story about what you're facing, what you're up against, and give you some practical advice of things that are options for you right now. So go to metabolicsolutions.net, take my free 2 minute health quiz, and I'll send you an action plan and steps that you should be doing right now based on where you are.
Excellent. Thanks so much, Kevin, for sharing that, for where our listeners and watchers can contact and follow you after this conversation. And thank you so much for sharing this really helpful information. I know I've learned a lot, so I can only imagine for people that are listening and watching how much they've learned as well. And so, for those that are listening and watching, if there's something that Kevin had mentioned here that really resonates with you, like take the time to really reflect on that. Maybe take a walk on it and see where that really causes you to pay more attention to. If it makes sense to go ahead and take that next step, is where Kevin mentioned before, as far as how to contact them, go ahead and do so. Because I think the biggest takeaway I got from this conversation was we have the choice on how proactive we are about our health and wellness going forward. And it really is up to us, not necessarily our primary care physician on what we do. They're here to help. But ultimately, the 364 days that have elapsed after that visit, that's on us and what we decide to do with that. And I think that this conversation is very much empowering for us to learn what we can do and what we can learn from, and just take that next step, small as it may be, to help us in a better place for regarded health and wellness for us, not just now, but for many years to come. So we don't have to worry about that symptom to come in later on if we're doing the right things, that we're better prepared for whatever our life may lead with regards to our health. So, with that being said, as we close, to learn more about Life After 40, you can head on over to our website at lifeafter40.com. Feel free to connect with me, Philip, personally at philipblackett.com. And so, just as we close this conversation, just let this be a reminder for you, everyone listening, something I believe in quite deeply. Midlife is worth living and worth living well. So thanks so much, Kevin, for being a part of our conversation here. I learned a lot from you here. Thank you, everyone, for watching and listening. Feel free to share this with someone you think this could be helpful for as well. This has been Life After 40 Conversations with Philip Blackett. Thanks so much for watching and listening. Take care, and we'll see you in the next conversation. Bye for now.